Every death is a genuine human tragedy, and it's difficult to talk about them as though they're just statistics. But in any outbreak, numbers are an incredibly powerful tool to help experts work out how far-reaching it is and who it will impact. But numbers can also be extremely slippery. You can't think of numbers as cold, hard facts. Let me show you what I mean. Here is the data for the number of new cases over a 24-hour period for some of the world's worst affected countries. Now, by the time that this is broadcast, these numbers will have already changed, but the principle here is what's important. So from this graph here, the US is the highest in a 24-hour period. Meanwhile, Italy, the UK and Germany are roughly about even. Now, this data is very valuable, but it is not the complete picture because you cannot tell how many people have the virus unless you are testing them. So if instead I show you the number of tests that have been conducted in that same 24 hours, you will see something quite different. Now, again, the US here are the highest with 100,000 tests in 24 hours. But look at this. Italy are testing more than 3 times the number of people as the UK, and Germany here are conducting about 5 times more tests. Now, all of this points to the suspicion that the UK actually has way more cases than the numbers suggest. Some scientists have even estimated that we are only recording between 5 to 10% of symptomatic cases. And that is part of the reason why you will see analysts increasingly talking about deaths rather than cases. Now, let me show you the data from China for the proportion of serious cases and deaths by age group. There is no doubt that this is a virus that disproportionately affects older people. But this here isn't the entire picture, and it's very easy to miss something significant because if you look at the total number of reported cases, far more people in their 40s and their 50s are catching this disease than people who are in their 70s and 80s. And that means that there are still many people under 50 who are still seriously affected. But unless you test absolutely everyone, even children, even people who don't have any symptoms, we really don't know these numbers for sure.